responsible for knee extension. Okay, you might come across patient says that I can't do extension or abduction of my shoulder. Shoulder को ऐसे move करने के लिए नहीं आता, या फिर with a very difficult I extend my knee joint. Okay, बहुत पेन होता है, रेडिएटिंग पेन रहता है, knee extend करने के लिए या फिर bend करने के लिए मुझे बहुत तकलीफ होती है. Okay, so all things are because of the involvement of these myotones. तो अगर आपको if you come across such type of symptoms, then think about myotones and later on you can plan out for the particular treatment, how it has to be done. Okay, then these are the diagrammatic representation or distribution of myotones. Wherein C1 to C2 it helps in extension of neck as well as flexion of the neck. Wherein C3 C4 helps for neck lateral flexion, shoulder elevation, shoulder abduction by C5 as we mentioned earlier. Like here, L4 helps in ankle dorsiflexion. L4 helps for ankle dorsiflexion. Some patients tell that I can't extend or I can't flex my ankle joint. Okay, so that's because of there be pathology or there might be compression at the level of L4. So there you can concentrate the VIDDHAKARMA or AGNIKARMA on the level of L4. Okay, so these are myotones. Then after understanding these basics, whatever the mode of action of AGNIKARMA might be there or mode of action of VIDDHAKARMA as per modern and allopathic sciences, then after taking the knowledge of these dermatomes and myotones, we can now go into specific disease conditions where we commonly come across these conditions in orthopedics. Okay, so we deal such pathologies which are very common in routine practices. With taking these as examples, we can deal approach how approach has to be done for these pathologies. Vishwaji. First thing is Vishwaji. Okay, Vishwaji, which can usually be correlated to cervical spondylosis. Okay, wherein patient complains of radiating pain from cervical region till upper limb. Wherever the involvement of nerve will be there, the patient complains of pain as well as the patient complains of sometimes it might be associated with tingling sensation as well. Okay, so that Vishwaji. यहाँ पे क्या होता है? There will be more amount of pain will be there along with the numbness or tingling sensation. So coming to treatment aspect, how it has to be treated or how it has to be considered. See, in classics, these are references as per Acharya Shushruta Sharira Sanet. First thing is Rudrasi Vishwacho Sankuchita Janu Urparasya. Rudrasi Vishwacho Sankuchita Janu Urparasya. Okay, Rudrasi Niva Vishwacha.
As well as medial. Okay, so here in these conditions also you need to perform VIDDHAKARMA and lateral articulate joint, and in the medial articulate joint as well. Medial articulate joint allu VIDDHAKARMA ಮಾಡಬೇಕು. Then in between the fossas, see, this is patella and you find a fossa here. Okay, these fossa area also you need to perform the VIDDHAKARMA. ಇಲ್ಲೂ ಮಾಡಬೇಕು, ಇಲ್ಲಿ ಮಾಡಬೇಕು, articulate joint ಇಲ್ಲಿ ಮಾಡಬೇಕು, ಇಲ್ಲೂ VIDDHAKARMA ಮಾಡಬೇಕು. But AGNIKARMA only has to be performed on the articulate joint as well as with the fossas. And in the pic you have seen, in the fossa they were doing AGNIKARMA.
All the points with the karma and only these points.
AGNIKARMA. ಪಾದದಾದಲ್ಲಿ ಕ್ಷಿಪ್ರ.
Sir, it's a pediatric infection. First of all, I'll be hearing about the CME, which is conducted by AYUSH of India along with collaboration with AYURVEDIC. This particular CME is going on all over India also, and Karnataka branch is continuing since last 2.5 years. I'm proud to tell that we are about eminent personalities like Dr. KADLI sir, who are coming down and it's helping a lot of doctors do their practice, and they are giving us a knowledge how it can be implemented in general practice also. It doesn't mean that they are doing it in a hospital or you need a Panchakarma for that center or that. These eminent personalities are giving us the thorough knowledge which can be done in the general practice in your OP level. Really, it's a fantastic moment. Now I'll give to Dr. Aparna.
Myself, Dr. Aparna. Today's session from Dr. SUPREET was very wonderful. He explained
Respect for giving me an opportunity to give or deliver the lecture in front of all the eminent workers. Ma'am, basically VIDDHAKARMA and AGNIKARMA are very important procedures of mentioned under the Ayurveda, where they can help both the disease management as well as pain management. Nowadays, pain is a very important aspect where every individual undergoes pain on a daily routine basis, one or other day. So to manage those pains, nowadays medicines are not sufficient. If sufficient also, they will be having a very adverse effect of their own. So these Pitta and Agnikarma are such procedures which help in managing both the pain as well as the disease.
Myself, Dwdt. Can you please let us know in which diseases we can use these treatments and how frequently they can be done?
Coming to diseases, there are various types of diseases are there. Like if you want to manage it in pain, it can be done in conditions of sciatic, or it can be done in conditions of osteoarthritis. Or if you treat it as a disease entity, it can be done in conditions like autisms, or it can be done in conditions like kidney disorders, like if a patient is suffering from chronic kidney disease, or if the patient is suffering from renal KADLI. Very wide entity of diseases are there.
Can it be done in a general practice in OPD level? Can we do this?
Yes, sir, definitely it can be done in a general practice, in a routine OPD basis, because you don't need any major setup for this thing. Only whatever the prescribed needles are there and whatever the prescribed shalakas are there, with the help of them, you can perform it on a OPD basis, sir.
Thank you. You can see that the eminent personalities, the way they are giving the knowledge, it's helping a lot of doctors. And in future, will be giving most of the interactions and will be calling Dr. Sir to give it a live demonstration also. The live workshop is there and it will be done, all of you will be given